that conversation. All right, good day, everyone. So I'm Dr. Kitty Redula. I'm a graduate, in fact, of the Gullas College of Medicine. So way back, even how many years ago, we've been multicultural. So during my time, I've been classmates with Thais, with Americans, Canadians. So pretty much, it has always been diverse. Like more than 20 years, we've been having international students. So you'd be assured that the culture here in GCM is really adapt to different populations. So we kind of know what each country would need with regards to the examinations for your licensure exams, about your requirements to satisfy what you need to be able to practice in different countries. And also the unique thing about GCM having more than 20 different nationalities is that we kind of know and we are quick in adopting new policies from different countries. Last year, Thailand told us that they have a new program that they require all the graduating students to have a particular examination to be passed or complied. It took us less than a year to really comply because that way we're already adapt to the changes that each country would really create along the way. So the flexibility of our the compliances to different countries have been something that we've been strong. But going back, when you talk about a choice of medical education, you really look at it on a holistic view. Who are my teachers? Where am I staying? Who is gonna mold me? So here in GCM, our dean, Dr. Laiko, he is a US trained neurologist, and I myself have a few years of practice in the healthcare setting in the US. And our medical educational unit head have master's program or degree holders from the US. So you'd see GCM really puts premium onto the leaders that they're putting here because that way they want everybody who graduates from GCM are already ready to really face different parts of the world's need for healthcare. So that's one thing you'd be confident about the leaders that you have in the school. Our faculties, they are all in different fields. We have OBGYN, internists, surgeons, OPSAC. We even have a lot of doctors who have master's degree in education. It's different to be a clinician, but it's also different to be an educator. And you are assured that our programs are really run by educators, meaning doctors who dedicate a portion of their time to really have a degree in education. With regards to students, as Ma'am Kat mentioned earlier, we have this
Yeah, hello,
unique
Gobi.
program. This is not really something that a
Namiyan
lot
doon
of
na so
schools adopt, but we're one of the few who have what you call a mentorship program, meaning
mi
it's a
ofisi ya
one-to-one correspondence.
webinar
Each
binti mi ofie.
student who comes here to the Philippines would have an assigned mentor, meaning it's not a
What the
tutorial
person
per se, but
okay,
it's
person
really a relationship between a doctor and a student to really help them adjust not just on the Philippine culture but more on the
okay, what they
Philippine
send the details no
education. Like for example, we put premium on really developing your mental health. There would be times that more than the load of the education, you would be having problems
okay,
adjusting to
what
the
they send the
place,
FMA
adjusting
mi
to
view
the
webinar na
people.
may
These
hire
are
why
things that the doctors would personally help
listen
you
that
get through it. And also the language, yes, it's definitely true that all or most of the Cebuanos or in the Philippines speak Bisaya. The vendors, the security guards, the cab drivers, they all. But here in GCM, we just recently started a program. It's Bisaya school or Bisaya class, meaning there will be particular people assigned to teach basic Bisaya. It's for survival, both here in the Philippines and when you go into your clerkship or when you do handle patients, if at all you need some first aid of Bisaya, you will be taught about it. So that's one thing. And also, as mentioned, we also have hands-on clinical experience. Based in the US and in the other countries, they usually work on mannequins. Yes, we do have mannequins, but more than that, we have the personal experiences. Real life patients are really part of our education system. You could put an IV on a person, you intubate patients. The clerks even do surgery. When I was fourth year, I was able to already assist to do appendectomy. So that way, when you're done, you pretty much have covered a lot of the practices that you are supposed to be done when you are graduating. And more than that, our thrust is not just to educate, but to really make sure that our students are board passers. So meaning it's not enough to just educate you. It is our thrust to really make you doctors, meaning we create programs that would help you pass your board exams. We have review programs, especially during fourth year. We pull out our students often to really conduct review classes so that when they graduate and are ready to take the board exams, they have at least a year of preparation for that. And also, we have a lot of different exposures. Just a few months back, I had a team of 4 or 5 students. We went to Chiang Mai, to university in Thailand, to expose our students to international competitions. Few weeks ago, I was on a leadership camp. I brought students with me so that this way, it's not just more on academia or education. We want to mold a holistic doctor in the end. So the exposures that we give aren't just academic in nature. So we want somebody who can speak well, who can relate well, and of course, who really has a good grasp in education. So in and out, and we put premium, a lot of premium on student feedback. In fact, many years ago, our classes were stretched to until the weekend, but because of student feedback, meaning at the end of the semester, we asked them what worked, what did not work. And through those feedbacks, we created better outcomes, better curriculum, because our students were really proactive. And we just don't collect those information. We use those information to really curate our program. So rest assured, it is an open communication between the academics, because there are notions in other countries, or at least in other schools, that there's a distance between a doctor and a student, where doctors are untouchable mentors. But here we make it an inclusive environment wherein you have access to your dean, to your associate dean, to your teachers and faculty. So that's one thing that we really want to further develop among the students, that the communication here is both ways. And of course, as mentioned, have a lot of nationalities. We respect and celebrate a lot of cultural programs. We even celebrate each and most of the country's Independence Day, or whatever it is that you hold value to your culture. So overall, I'd say the best asset of our school is flexibility in many ways. Flexible in terms of the changing technology. We integrated AI to our curriculum. We know how it is now, that it's not enough to stick with the old ways of education. AI is part of a topic that we teach in first year, as early as first year. We also evolve in terms of the qualifications of our faculty. We continue to send our faculties to a lot of post-education training, so that way we will all be at par to what the world setting would be. And also, I don't know if it was caught on one of our visuals or our videos, but once you go out of our campus, everything that you need pretty much is just a walking distance. If you need laundry, laundry is outside. If you need food for particular, during my times, there were a lot of Thai and Korean, so all the restaurants, but like let's say 50 feet away from the school, are Korean restaurants. So we're very adaptable. If you need some food, some things that are unique to your country, it will be sprouting out right in front of the school. So it's very accessible. We are just less than 10 minutes away from a big mall, less than 10 minutes away. In fact, we have a hospital on our campus. So the convenience of your parents knowing that you are just a walking distance of anywhere, that is something that I, as a parent myself, would want to send my child, like not wondering, would they have food, would they have access to this. Even a police station is located near our campus. So security-wise, convenient-wise, the logistics of moving from one country to another, GCM pretty much has curated it to be comfortable and convenient. Our dormitories are right inside the campus. All the things, the groceries, churches, and all other things, restaurants, they're all within walking distance. So with that, I don't think logistics will be an issue. And as what Ma'am Kat says, it is pretty much affordable, and you would be surprised that the currency of your money goes a long, long way here in the Philippines. So, and also overall, when you go to a different, I was once a foreigner to a different country. I know the anxiety of not knowing who I am around with. You will be assured that we have marshals, we have security guards 24 hours within our vicinity. So pretty much, I'd say GCM is a good choice, especially for somebody going for a foreign medical education. So pretty much that's it for me. If you have any questions, you can throw it for me or Ma'am Kat.
I think, Dr. Kitty, I noticed there were a couple of questions in the chat already, and maybe we can address a couple of them. So the first one, there were a couple of students who asked, when is the next intake? So our intake happens twice a year. We have a batch for medicine every August and every January. So our next intake for this year is going to be August of 2026. And then the next, and this is for medicine, not yet for the pre-med. And our next intake for medicine in 2027 is going to be in January. So what we usually do is that in the Philippines, there is one requirement since we're following an MD program, meaning it is already a postgraduate degree. It is not similar to what you have in Ghana, which is considered a bachelor's degree. What you have is the same as what we follow in India. But considering that this is already a postgraduate degree, you need to have something known as a pre-medical degree, which is any bachelorette or any finance, or you have a degree in business, or maybe arts, or maybe architecture, whatever it may be, you can still qualify for medicine, and or as long as you have a degree in hand. And for those who are yet to finish a degree or have just come straight out of high school, we offer something known as the pre-med program, which is a 16-month program that is conducted here within the same campus. Once you're done with the 16-month program, you will be going straight into medicine. But this 16-month program is conducted only for students that are applying to our medical program. This usually is a 4-year degree course, but we have shortened it to 16 months only for our students. So I did see a question here where students had asked if there is a difference between the 6-year and the 4-year medical program. We do not offer a 6-year medical program. Our medical program is only 4 years long. Probably what you mean is the additional 16 months that they're going to be doing, 16 to 18 months that the students are going to be doing for pre-med. That is not part of the MD program. So I hope that clarifies that question. Other than that, I did see a couple of students asking for the cost of living. It really depends on what your lifestyle is going to look like. You can live extremely comfortably in less than $150 per month. That is including your lodging, your probably lodging, including all your rent, your electricity, your water expenses, as well as food. Now, it really depends on what type of housing you're looking for. I know of students that have even spent less than that. I know students who could afford it that have spent even upwards of $500 a month, but that was something that they chose to do. So I know of some students who split the $150 three ways. So there are three people living in the same accommodation and they split that money amongst the three of them. So it's extremely affordable. And speaking of food, we've recently launched a new restaurant on campus that caters to African students. It's purely African food. We, in fact, have a Nigerian chef that's handling it. So if there's something, if you're sensitive to the food here in the Philippines, you can, of course, avail those services. They also offer a monthly package for that. I'm not sure how much it is, but I can definitely inquire and communicate the same to Study Right, and they can convey that message to you. Other than that, there's a lot of African restaurants throughout the city, and it's quite convenient access. Like Dr. T mentioned, everything is nearby. Another important thing is that our students, it's preferable for you to stay in the campus, but if you choose not to, if there are certain things that you prefer having outside, there's a lot of accommodation available within 2 or 3 kilometers from the campus. So it's walkable distance, especially when you have classes that start as early as 8 a.m. in the morning. It's important that you stay somewhere nearby, take you too much time to commute. So there are a lot of places that are nearby that you can rent out. Some other questions were okay, the cost of accommodation, I think I clarified that. And then the tuition fee per semester, I think Study Right will be sharing the information regarding the tuition fee to all of you as well. So hopefully you can get in touch with them for that. Is there any other? Okay, which city is the medical campus in? Our medical campus is in Cebu City. It is in the center of the Philippines. If you look at Philippines, the map of the Philippines, it's split in three different major island areas. So we have Luzon, that is the north, Visayas, that is the center, and Mindanao, that is in the south. So Visayas is known worldwide for its cultural tourism as well as educational. Uh, I would say one of the leading centers for education as well in the Philippines. So we're seated right in the middle, and I would say it's one of the islands that is most accessed or most visited by tourists as well. So it's Cebu City. We have the hospital, like Doc Kitty mentioned, the hospital that you will soon be practicing in or will be visiting is also situated inside the same campus. Other than the hospital inside the campus, we are associated with another 12 hospitals throughout the city that you will be practicing or going to, a combination of both private and government hospitals. So a couple of other questions. How many years will you spend in the classroom? Okay, so that's a good question. So we have our entire medical program split into three phases. You have the preclinical, you have the paraclinical, and then you have the clinical exposure. The preclinical rather is all of your theoretical concepts that you will be learning in first year and in second year. During the preclinical phase, you will still be going to hospitals. Maybe not as often as you would if you go to, as opposed to third year and fourth year, but you will still be going to hospitals as early as your first and second years. But these years are meant to create a strong foundation for your theoretical knowledge before you can actually practice on a patient. Your third year is going to be 50-50. You will be doing 50% of your third year in class and 50% of your third year in a hospital. And fourth year is going to be completely dedicated to hospital rotation. You will not be coming to class anymore. Your entire day is going to be spent inside the hospital. And these hospitals are varied. Between the 12 hospitals, you'll be doing different departmental rotations in different hospitals. So based on which rotation you have for the month, you will be changing your hospital, but it's completely practical. There will be no theoretical exposure at that time. Someone has asked about scholarship. Yes, we do have scholarship, but they're limited. We offer scholarships for international students as well, but it is a first come, first served basis, and our scholarship requirements can be found on our website. You can try to apply, but there are very limited slots available every year. And for our August batch scholarship, we open as early as January of 2000. For this year particularly, we opened our scholarship as early as January 2026. So many of our slots are already full. There is a very high criteria for scholarship. You need to have high honors, or you should have graduated with a degree with high honors. So you can apply, but it really depends on the availability of the slots and your credentials. Some other questions. Is the MD certificate curriculum same? Okay, yes. Regardless of whether or not you're taking MBBS or MD, it is exactly the same. In fact, I would say an MD is a little bit more practically reliant on the student's knowledge than an MBBS. But it's exactly the same, and it qualifies in the same nature when you go back to your home country to practice. We've had hundreds of students from Africa that have already graduated, gone back home. In fact, we had 6 of our students who recently took the board examination from the last graduation, and they've done really well. So there is no problem with the degree being recognized in your country or in any other country for that matter. Any other questions? Yes, again, for the tuition fee, please reach out to StudyRight. They'll be communicating the details of the tuition fee to you. August intake, will you start the MD program? No, we're starting the MD program. This is in response to Mr. Roland. We start our August program for medicine this year in August of 2026. And the pre-med program will also start around the same time. So depending on which you're enrolling for, once you apply, we will get the details of yours, and then we'll be enrolling you into the pre-med or the medical program depending on your credentials. Any other questions that you'd like for us to answer? Oh, I think this is a question regarding your religion and faith. You'd be happy to know that this country is famously known to be Catholic and Christian, so there is no discrimination. There is no problem when it comes to your freedom to practice your faith. We have students from so many different nationalities, and we keep every nationality we treat the same way. In fact, we have a Muslim community here in the country, in Philippines and in GCM as well. We're a very active Muslim community. We have a Christian community. We have a Pentecostal community. We have I myself being Seventh-day Adventist. We also have a separate community for that, so you don't have to worry about that. As long as you're keeping up with your academics, your religion is never going to interfere. Okay. Do you accept transfer students? Yes, we do accept transfer students, but there might be a difference in the curriculum of your institution that you're studying in and our school. So we will evaluate your credentials to make sure that you don't miss out on any of the prerequisite subjects before you can move to the next academic year. But in short, yes, we do accept transferees. Can someone be enrolled while still preparing for NMAT? Yes, you can, but it will be considered as a provisional enrollment because NMAT is a criteria for enrollment. We'll consider it as provisional until you pass your NMAT examination. It is not a very difficult examination, and if you require some assistance with preparing for this, please let me know. I can help enroll you into an NMAT coaching center. We're also offering, starting this month, we're offering NMAT coaching here in the campus itself. We can offer it online. The NMAT coaching does not usually exceed more than about a month or a month and a half. Since it is a fairly easy examination that you should not worry about, we can offer. So if you intend on taking the NMAT and you think that you need some assistance, please let us know. We can include you in our NMAT preparation courses that we're offering. Another question. Will there be vacations to visit? Yes, of course. There are going to be at least 2 vacations every year that you're going to get. That is a semester break as well as your Christmas vacation that we offer. But sometimes the vacation might be small, maybe even just a week long or 2 weeks long. It's really up to you whether or not you want to use that time to go home or whether you want to explore the country. So it's up to you. We will be posting your schedules every semester, so you can use that to gauge whether you want to travel back home or whether you want to stay back here to finish some of your academic requirements or even visit the Philippines islands. So how many times can you sit for the NMAT before your provisional? So this is a good question as well. It is absolutely important for you to have your NMAT because not only is it a requirement for fulfilling your academic processes, but it is also necessary for you to secure your NMAT in order to apply for your visa. So ideally, the first time you take your NMAT, you should have already passed. You should have already passed your NMAT before you come here to the Philippines, so we can apply for the next step for your visa. But in case a student has not been able to pass their NMAT in the first go, we'll allow you to take it another time, a second time. But if you're going to have to take it a third time, it's going to be difficult to adjust to the academic requirements as well as the visa requirements. So we encourage you to try to finish it in the second round itself, and we will try to support you as much as we can so that you don't fail. Other questions are, can you work alongside studies as international student? I know of several students from Africa that are currently pursuing their medical education as well as working. Your opportunities for work are not as broad or versatile as it would be in a few other countries. There are a lot of students that are currently working. They considering the schedule for your education is also going to be quite tight and packed. A lot of students opt for online work opportunities like executive assistants or virtual assistants. And yes, they were able to successfully graduate as well while working in this country. So, fresh graduates are waiting for their credentials. Can they join August intake? Yes, you can. If you're still waiting for your credentials, you can join the August intake. But again, you will be considered only provisionally enrolled until we can get all of your documents in place. With regards to USMLE, well, actually, this is an opportunistic time because just last week I was told that one of our students from Nigeria passed his step 2 USMLE and he's entering into his 4th year now. So you are more than free to apply for any board examination that you please. And if at all you require some time off to prepare for the board examinations, we also allow that. We have in the past given students even as much as a couple of weeks in order for them to prepare for their examination. Even for the board examination, if there is some exams that you'd like to prepare, even back in Ghana or Nigeria, we also give you some time for that. So there should be no problem with taking your USMLE. We also have a lot of doctors here in GCM that have actually successfully finished their USMLE. So they can also provide some guidance as to how you can take it and what would be the best strategies to study for the examination. Are there mentorship programs for licensing exam? Yes. So that's what I just discussed a while ago. We also have some mentors that have specifically finished their USMLE examination, their USMLE, or have actually practiced in America. So you can approach them for some, maybe some guidance or for any questions that you might have regarding the examination. Can I start the NMAT now to write early and start the MD straight in August? Yes, you can take. I think the next NMAT examination is coming up in October, and I believe the dates for registering for that examination have already opened. You can take that October examination and still be enrolled with us in August, but we will only consider you provisionally enrolled until we can get your NMAT results. Again, for the tuition fee, I think StudyRight will be sharing the breakdown of the tuition fee with all of you once we're done with this conversation or during the course of this conversation as well. So any other questions that you'd like us to answer? Have I missed any questions? Please, if you could text us again if there's any question that you think we have not addressed so far. I'm just scrolling through the messages to see if I've addressed mostly everything.
There's one question about NMAT being online. So yes, NMAT is an online exam.
Yes. So you can take it even while you're while you're at home. Okay, we don't offer nursing. We only offer medicine. So if you're looking for nursing programs, we can probably talk to a couple of other universities, but in GCM, we only offer medicine. I want to transfer. Will I be exempted? I did 1 year. So this is in regards to the last message that I can see. If you've already finished 1 year of medicine in another country or in another university, please send us your credentials so we can evaluate. Like I mentioned, there is a difference of curriculum between all universities that offer medical education. What you might learn in first year in a different university might be different from what you learn in first year here in GCM. So it's important that we evaluate you to make sure that you don't have any subjects that you're lacking in our curriculum before we can promote you to second year. So please send us your credentials so we can deliberate on your case. Okay, so no, we don't offer physiotherapy or nursing. Like I mentioned, we only offer the medical program here in GCM. Fresh graduates are waiting for credentials will enroll directly to MD or pre-med. Okay, so students who have finished high school or their A levels will be required to go to pre-med before they can go to MD. But students that have already finished a bachelor's degree can go straight to medicine. They do not need to enroll in pre-med. Okay. Yes. So the tuition fee again, I think Study Right will be sharing that information with you. Okay. Um, okay. So to Mr. Roland, regarding your education from Armenia, if you could share with us with if you could share any details that you have with you so that we can deliberate, because like I mentioned, there is going to be a difference in the curriculum of every university in every country. So we'd have to deliberate your case to be able to better answer your question. So if you could send us all of those details, we can find out as to which year would be best suited for you to transfer into when you come here to GCM. We'll be happy to help.
I think one of the students, Alvord, your question was fresh graduates are waiting for credentials. Alvord, as we know, you've already reached out to us and then you've completed your bachelor's degree, but you are awaiting your bachelor's transcript and certificate, right? So this is what we can do in collaboration with the university. If you are awaiting your credentials, submit the updated transcript that you have and then ask your university to provide you a provisional certificate or a bona fide letter, right? We can speak with the university as Miss Katrina is here and then Dr. Kitty is also here. We can speak with them so that they can consider you for a pre-notice of acceptance letter. And then once we get all the credentials sent, you'll get your full document given to you. Then you proceed with the other processes of your visa in reporting to your campus. So it is practically acceptable. And then to all of you who are having your bachelor's degree and you are waiting for the NMAT exam in October, the registration portal is going to start next month. We are going to start with the application process for the NMAT. Whilst you are preparing for the NMAT, you can do your processes fast and then report to campus. This is an arrangement that we've done with the university. So you can start the intake with the September-August intake whilst you are preparing to take your NMAT in October. The condition is you must pass your NMAT, right? There is no two ways about that. And if you are getting to campus on time, then it means you can also join the students who are preparing or possibly join the NMAT classes that is going on campus, as Miss Katrina talked about, and it's going to be a great advantage for you to also prepare really well and then pass the exam. So yes, all of you who are going for the MD, that is the 4-year graduate entry medical program, this is an advantage for you. You just need to reach out to us Steady Right Educational Consult. We have left our contact in the chat box. Pick it up from here, or if you are part of our groups, you can reach out to any of the directors or the administrators of those groups, and then we will communicate with you. Please do not make any mistake. If you have your high school, you've completed your high school, whether it is A-level, grade 12, senior 4, or senior 6 from Uganda, from Ghana, the WASI, Nigeria, WAEC, right? If you've completed that, then the right next step is for you to take the pre-med, right? So you take the pre-med, and then GCM has made it very easier for you to take the pre-med. Instead of taking the pre-med for about 3-4 years in other jurisdictions, GCM is saying they've made everything simple. They've compact everything. Take the pre-med for 16 to 24 months, depending on your strength, 16 to 24 months, which is approximately 2 years. Complete the pre-med, sit for the NMAT, and then enroll into the MD program in the same university. So we are talking about a total of 6 approximate years for the medical program in the Philippines. We hope this is much clearer, in addition to what our able guests have shared. So if you have any concerns, reach out to Steady Right Educational Consult. We'll be very glad to assist you seamlessly. So the next session we are going to have briefly is the admission director at Steady Right Educational Consult going to highlight the fee structure. Most of you have been asking about the fees, right? So we have the fee structure session where he's going to briefly discuss that with you so you can understand. And please be jotting down your questions. If you have any question, please be jotting them down right after here. You can ask, or if we are not able to exhaust your questions, because this is just a few moment session, right after here, reach out to us, and then we'll be able to take you through a comprehensive counseling session to help you understand really well, right? So please, Mr. Kamara, we want to welcome you to take us through the tuition fee aspect, and then also if Dr. Kitty and then Miss Katrina will have any final words for the student, it should be after Mr. Kamara is done. So I'm sure he's going to be quite snappy with this one and then help all of us. So please stay tuned and then get the information right. Thank you.
All right, thank you very much. Am I audible? All right, thank you. So thank you very much, Ms. Katrina and Dr. Kitty, for your information. I believe our participants have really learned a lot. Going straight forward to the admission process and the fee structure. So what we do at Steady Right Educational Consult. So when it comes to the admission requirement to receive your notice of acceptance, for those who already have the bachelor's degree, those going straight into the MD program, you need to submit your WASI. If you are in Nigeria, your WAEC or high school certificate, we will need that. We will need your bachelor's degree and also the transcript. Then we will need your passport. These are very easy documents you need to get right to be able to start your admission process to get your notice of acceptance. If you are going for the pre-med, it is very easy. Just submit your high school results and your passport, right? So that you'll be able to get you the notice of acceptance. If you are yet to receive, those who just completed WASI or wrote your high school exam and you are waiting your results, to start and get your notice of acceptance, get us your passport, then go to your high school and get us a transcript from your high school. So if you're able to get us the transcript from your high school as you are waiting your high school result or your WASI result, we will be able to use that to get you the provisional notice of acceptance for the September or August-September intake, right? So that it comes to getting you the notice of acceptance. Then with the collaboration that we have with the Gullas College of Medicine, the help of Ms. Katrina and her staff, getting you the notice of acceptance can be within 24 to 48 hours. We should be able to receive your notice of acceptance when we submit your application to the university. So it is not something that takes time for you to get it. If you submit your application today, by tomorrow next, your notice of acceptance will be with you to start your process. Now, going straight into the fee structure, let's start with those going for the MD, which is those who already have the bachelor's degree and are going for the Doctor of Medicine. Now, the semester fee, Gullas College of Medicine takes, or fees are paid semester-wise. So the semester fee for Gullas is 2,540 per semester. As at now, 2,540 per semester dollars. So in a year, we are talking about around 5,080 or $5,000 per year as your tuition fee, right? But Gullas have a very flexible payment structure, which makes students to be able to complete their fees semester-wise. So it's not compulsory that before you start your first semester, you need to clear all the 5,080. They give the flexibility for students to do payments semester-wise. So 2,540, then you can start your program. Then also, when you get to campus, there are other documentations that the university has to do for you in terms of visa conversion, some certifications, and other clearance, right? Which, when you get to campus, the university has to help you get that. For example, those from Ghana, you have a visa-free waiver within the Ghanaian and the Filipino government, which makes you to be able to travel to the Philippines on a tourist visa. Now, when you get to the country, the school has to help you convert this your tourist visa into a student visa. So all those process comes at a cost, right? Together with other clearance certification that you will need. And the cost will be $900. Where you get to campus, you need to pay to the admission department so that you will be able to do that for that. So can you wait to let me share my screen so that those who are not getting it can also get it too. Give me 1 minute. Right. So I believe you can see the screen. Yes. So that is the fee structure I was talking about, which is 2,540 per semester. That's you pay per semester. So in a year, it is 5,080. Then this is the visa conversion and other documentation that you pay, which is $900. When you get to campus, you pay for that. Now, the application that we do together with the registration of the NMAT that you write, that is the first payment you make, which is $260. Now, a lot of you were asking about the accommodation, and Ms. Katrina explained that to you very well. There is a campus accommodation and off-campus accommodation. So if you want to stay, as Ms. Katrina was saying, sometimes your classes can start as early as 6 a.m., 7 a.m. So you don't want to stay far away from campus to be able to access some of the things. So you want to be on the campus accommodation. Then if you are staying on the campus accommodation, it's going to cost you $300 per month. And it comes with accommodation, expensive bills. So you'll be fed every day, I think 3 times a day, and you pay $300 every month for that. If you want to stay off campus, as Ms. Katrina said, you can spend as low as $150 to $250 per month, depending on how luxurious you want to live your life, right, as an international student. Because, as he said, all of us have been international students before, and you know those who want to live luxury and those who want to live moderate. So if you are living off campus, then it means you are going to take care of your own food and also depend on to the type of accommodation that you want. And this is the budget you can have for yourself. It can be more, it can be less, as she said. But if you are staying on a university campus, I think currently this is the fixed amount that you'll be paying every month for that. So this is the fee structure for those going into the MD program. So if there's any question on that, I think you can ask for explanation. Then this captain also mentioned about scholarship that's is there, but we also had some arrangements with the university, which they were giving 20% discount for all those who are getting their notice of acceptance for the first year. Please take it and listen to it very well. First year. So most of our students who have received their notice of acceptance and the fee structure document, you will realize that they've given you 20% discount for the first year. Now, the 20% discount was supposed to end last month, April, the deadline. But because of the relationship we have with Gullas, they extended it to the 31st, 30th of this month, right? For the last date for those who have received their notice of acceptance to be able to make at least half of their first semester fee to be able to secure that. So if you are here and you've received your notice of acceptance, you've received your fee structure, today is the last day for you to be able to avail that opportunity of your 20% discount. Or we are saying that this week can be your last week for you to be able to avail that opportunity. So if you have not done that and the deadline passed, there's nothing we can do on that. So please, if you really want to avail that opportunity, you have up to the end of this week to be able to avail that opportunity that we have been able to secure for you. If not, you will be able, then you are going to pay the fixed 2,540, which is $5,080 per year as your tuition fee. Any question for us so that we can continue? If there's any question. For those going in for the MD. Yes, so I think I can see about preparatory class. As Ms. Katrina said, if you are interested in having a preparatory class for the NMAT, reach out to us and we will also reach out to GCM, get you registered for that. But please note that it's not going to be free. Yes, it's not going to be free. You will pay something small for that. And that is not part of your tuition fee. It is an extra cost that you have to bear. So don't take notice of that. Those looking for the extra classes.
All right, so this question is to Miss Katrina. Since you are here, please attend to this particular concern for us. So for the MD applicants who were given the 20% scholarship, right, and then it is actually ending today. You remember we've had some extensive conversation on this. She can attest to the fact that
Yes.
we have been pushing for the student from Africa, especially our students, to get this
Yes.
20% scholarship because of the unique relationship that Study Right Educational Consult has with GCM. So if you look at the fee structure, as we are speaking, all our students who got the admission letters, right, you realize that there is an additional scholarship letter that is added. And then at the bottom of that additional scholarship letter, it is written that you need to confirm this particular scholarship by making at least the first semester tuition fee payment on or before 30th June. On or before 30th June. Now, please pay attention. The university closed the scholarship for the entire scholarship in April, right? And even the entire scholarship that they were giving to students was about 15%. So it's only Study Right Educational Consult that pushed for this 20% with the consideration from the university. And Miss Katrina here, she was able to speak with the management for us. And they are very strict on this. At this point, we cannot push them further because we were given enough probation time for you to get it. Some of you are in the groups. You never even bothered to pay attention to some of the information we were sharing. Some of you have even gotten your admissions, you've not paid yet. But today is the last day, right? But since Miss Katrina is here, we may want to hear from her if there is anything that she can do more. We have exhausted all our protocols for this particular opportunity at the moment. So we would want her to share with us if there is anything they can do to extend this particular scholarship for the MD student. This particular scholarship is not for the pre-med. It is only for the MD applicant. That is those who
Yes.
have bachelor's degree or what you say first degree, and they are going for the MD. Those are the ones who can benefit from the 20% scholarship. So if you already have your admission letter, and then today you can pay your tuition fee, right? You can pay your tuition fee, at least the first semester tuition fee, then it means you can avail this scholarship. This is the only day. And we've also had some consent from many of our students who are already having the admission letter and they wanted to make the payment, but because of the conditions at the bank, Ghana, for instance, there is some flooding that is happening, so some of them were not able to proceed in making the payment and all of that. So yesterday I had this conversation with Miss Katrina, and she was trying to give some allowance. So let's hear from her if there is something that they can do
Yes.
for our student this time. Yeah.
So, Sir Roxanne, maybe what we can, Roxanne, sorry, I think what we can do is maybe we can extend it by another 15 days,
Right.
the conversation that you and I had a
Right.
little earlier prior to the meeting. So, based on your request, and I do understand the situation right
Right.
now, it's not the best and most ideal. So, maybe we
Yeah.
can extend the discount for another 15 days. So I
Right.
hope that this can encourage a few more students
Right.
to enroll as quickly as possible and take this opportunity for
Right.
the 20% discount.
All right, all right. I think that is fairly said, and then this is going to be a great opportunity for our students. So for our students who are here, Roland Ali, you have a probationary period or a grace period of 15 days if you are willing to start your process. What happens is, because we are working directly with them, the admission letters or the notice of acceptance do not take time. Within 24 hours, we are able to help you get your admission when you apply. Then the next step will be you depositing your fees. We even spoke that for the first semester fee, which is the 2032, after the 20% scholarship, you can even pay 50% of that amount, okay, at least. But if you are in the capacity to pay all the first semester fee after the 20%, kindly do so, because it sets you free. And this is a great opportunity. I am a Ghanaian, right? And then we know how the educational system here in Ghana is. Not everybody can get the opportunity because the seats are limited. And the international, the other private universities also, you cannot pay. They are charging around 12,000, 13,000 US dollars per year. And GCM is giving you 5,000 US dollars per year as an international student, not as a local student, as an international student. We know international students who are coming to study in even the public universities where tuition fees are quite lower, they are paying higher, right? So this is a great opportunity for you as an international student going to study in the Philippines. So right from here, please reach out to us. Those of you who want to visit our office, right? If you are in Ghana or closer to the Ashanti region, Kumasi, then you are welcome to visit our office located at Bantama, opposite the MTN office. Bantama, opposite the MTN office. When you get to the Konfanoche Teaching Hospital, the stretch on the Bantama High Street, rightly opposite the MTN office, we share the same building with Odotobri Rural Bank. If you are not in Ghana, you shouldn't worry, because most of the students we have helped, they are mostly not Ghanaians. Nigeria, Zimbabwe, Zambia, Tanzania, Kenya, and South Sudan, and all of that. So if you are not in Ghana, you just need to connect with us on our WhatsApp platforms, or you just go to our website at www.s-rec.org, and then you scroll down. You'll be able to book an online counseling appointment with us. Our admission advisory committee will connect with you on the time that you are going to select. We will have the conversation with you, help you understand the processes, and then you can also begin your admission. The last NMAT exam that were written, some of our students from Nigeria did very well, and it was a great thing to know. They've not visited us in Ghana, but then they trusted the whole process because we were very, very transparent with them, and then they were able to understand the processes well. So right after here, we are inviting you. If you want to visit us, you are good to go. But if you can start your process, just connect with us on the WhatsApp number that we've shared here. Okay, the WhatsApp number that we've shared here. Right, the WhatsApp number that we've shared here, and then you can actually also message us and we can start your process. Somebody is asking the group link. We are trying to paste the group link here, but it's not possible, right? So take this number and then reach out. You'll be added to the group, right? Take this number and then reach out to us. We are trying to paste the group link here, but it's not possible. That is the whole issue that I'm facing here. But let's see. We are present on all social media handles, right, as S-REC, S-REC, that is Study Right Educational Consult. That is the name, Study Right Educational Consult. So if you check on all the social media platforms and then you search for S-REC, Instagram, the same thing, Facebook, the same thing, LinkedIn, the same thing, and then also TikTok, the same thing. So S-REC, and the contacts that you have there, right? We will see if we can be able to attend to all of you, and those who can take advantage of the discounted fee also, please do so before the deadline. So thank you very much, and we would like to also appreciate the presence of Miss Katrina Pillai and then Dr. Kitty Redula for making some time gracing this particular session. We recorded a good number of participants, and then we hope that maybe some other time we can still get you people again, because getting you people is very, very difficult. It's not that easy, but we are happy that today you made this time for our students. So thank you. If you have any final words for us, starting from Dr. Kitty, if you have any final words for our students, please kindly share.
Right.
before we end? Yeah.
I'm excited to welcome most of you here in our school. It's definitely gonna be one of the fun, exciting, uncertain era of your life because being a doctor doesn't stop the moment you finish education. But rest assured, we will equip you with the right attitude, integrity, and of course, education. So, everyone, I'm looking forward to meeting you here personally once you decide and when you decide to become a doctor. Thank you very much.
Thank you. Miss Katrina?
I think Dr. Kitty shares my sentiments as well. We're really happy to be able to meet all of you and give you some information about the school. And Philippines is really a wonderful country for foreigners. Being one myself, I can attest to that. And we've had a lot of good feedback for students as well, and they've reached amazing heights after moving on from GCM. So we hope something similar can happen for you as well. So like Dr. Kitty mentioned, we hope to see all of you here, and let us know if you have any questions. We'd be more than happy to answer those.
Right.
Yes.
Are there any further questions? If not, then we would like to wrap up with today's session and then continue sharing the updates in the various groups that we have with you. If there are any questions.
Thank you very much.
Right. Thank you. So I think at this point we can permit you to sign out, Miss Katrina.
Just one last thing.
Right.
I think there was Mr. Roland is looking for the email to which he can send his transcripts for the transfer.
Okay.
Maybe you can send us his documents.
Sure. So Roland, what you do is that
So
send your documents to us, and then we would directly share them with the university via the university email, right? So anytime a student is interested, the application team creates an application group for the student. All the documents are emailed to the university, and then they assess it on urgent basis for us. And within 24 hours, you get your admission letter or the notice of acceptance. So that is how the whole process is. So please, yes.
Mm-hmm. Okay.
So,
that'll be all from us. Thank you so much.
Thank you.
All right.
Thank
you. Thank you very much. Yeah. All right. Thank you all for joining. There's Nicholas Geraldo. Nicholas, your question is, what is the passing rate at GCM? If you ask of the passing rate, what are you talking about? Can you clarify? You can use the microphone and then speak to us. Can you clarify your question? Please, the email to send the transcript for transfer. So Nicholas, you can Roland, you can use the same email, which is info@srec.org. Okay, use this email, and then once you send this email, we'll be able to forward it to the university for them to look at it for you. Yeah. And then also do well to connect with us on WhatsApp. It will do you a lot of good. We can actually connect on a one-on-one basis and then help you understand any other thing as well. Is there any other question? I think somebody's hand is up. Roland, you can talk to us.
Sorry, please, can you hear me?
Yes, you are audible.
Thank you. I think it's a good thing, but I'm still going to ask of let's say the flight issue. What happens to that side when you submit it? If you get the acceptance letter, do you help with the visa acquisition to get the flight, or That one is left onto the student.
Where are you from, Mr. Roland? Where are you from?
I'm a Ghanaian. I'm in Accra right now.
Right. So if you are from Ghana, then you don't need a visa to visit the Philippines. Now, what happens is that the visa is in 2 stages, right? As a Ghanaian, you can visit the Philippines with what we call the visa-free status, right? And then this privilege, when you get there, the university will help you convert the visa-free to a student visa. If you are from Nigeria or other countries where you don't have this visa-free status to the Philippines, then there will be an embassy for you. So, example, Nigerians have embassies. So they do their visa there and get a special tourist visa. When they also get to the Philippines, the university will help them convert the special tourist visa to a student visa. So in any case, you get the final visa that mandates you as a student to study there in the Philippines. So when you are done with your admission, you get your admission letter, and then also, you get your admission letter. We help you do your document or your credential authentication or attestation at the Ministry of Foreign Affairs. Then from there, you send your documents that are attested to the consulate in Accra. So that there is a Philippines consulate in Accra. You send it there for them to authenticate. So that will be the final thing. And right after that, we can help you book your flight ticket to the Philippines. Yeah, so that is how we go about this.
Thank you so much.
Most welcome. Any other? Maxwell, Richmond, Maxi, and then also Sammy. Sammy, you joined us. I hope you are doing well.
Yes, sir. Yes, sir.
Right.
Great.
So if there are no further concerns, you connect with us. Yes, this particular opportunity is for those who want to study medicine in the Philippines. What is your concern? If you have any concern different from what we are discussing, you are a registered nurse and you are interested. Please, do you have a bachelor's degree in nursing or let's say diploma in nursing? Tia Samantha. You have both. So yes, you are eligible for the MD program or the graduate entry medical program in the Philippines. So take the number there and then reach out to us after this particular session. Good to go. So you are eligible. Yes, and then Nana El Chermano, David Echampon. How is it, sir?
Yeah, boss. Come again.
Yes. Is everything okay? How is it at your side?
Oh, everything was perfect.
Okay.
Yeah.
All right. All right. Then thank you all for joining. I think that will be all for the session for today. So we hope to meet you guys. Those of you who can visit our office too, please do well to visit. We'll be very happy to receive you all. Said you're also a nurse. I'm also a nurse with a diploma certificate. Yes, with a diploma, there is something we can do about that. Since you don't have a bachelor's degree yet, you will have to be assessed and then take a few months pre-med, right? Because when you do the pre-med in the Philippines, they give you a bachelor's degree. So since you don't have the bachelor's degree yet, you'll be allowed to do some few months. Instead of the 16 to 24 months for the pre-med, you'll not do all 16 to 24 months. You just do about some few months, about 8 or 6. It will depend on the university after the assessment. Then you take those months. After completion, you then register for the NMAT and then you enroll into the MD program. So that is the pathway for you. You can also take this opportunity. Are you clear, Richmond? All right, then I think at this point we can all sign out and then reconvene in the various groups. And thank you very much. Do have a great day. Bye-bye.